नमस्ते बेटा, खुश रहिए आप लोग। आई माई सेल्फ जीवन प्रोफेशनल एडमिशन फ्रॉम द डिपार्टमेंट ऑफ फैकल्टी ऑफ फिजियोथेरेपी एंड डायग्नोस्टिक। आई एम असिस्टेंट प्रोफेसर इन optometry discipline and I am working here in the Jyoti Vidyapit Women's University. It is the first state women's university in Rajasthan. Now we will discuss about the last topic, which was our last topic, that is our eyelid. In eyelid, we have discussed about the immunology of the eyelid and the development of the eyelid, how the eyelids are developed, and at what period of gestation our eyelids started develop, and what are the functions of eyelid and the different parts of our eyelids, like the eyelid positions, extent, and eyelid folds, creases. These we have studied in our last lecture. Today we will start by eyelid margins. In last lecture we have discussed about the canthi also. In our eye, two canthi are there, these caruncle and pellica similaris. These were also discussed in the last lecture. Now today we will study about the eyelid margins. What are the eyelid margins? Two eyelid margins. Which are the eyelid margins? This on which the eyelashes are attached. These are known as the eyelid margins. This eyelid margins, these are 2 mm in width, and each eyelid margin is divided into two parts by the lachrymal papilla and by the ciliary portion. One is the lachrymal portion, medially devoid of the lashes and the glands, and the ciliary portion laterally. Laterally is the ciliary portion, and the lachrymal papilla is in the medially portion. Approximately 100 to 150 cilia are there in our one eyelid, and 50 to 75 cilia are there in the lower eyelid, arranged in 2 to 4 rows. Now there are some glands also in our eyelid. Which are these glands? These glands are the that gland of Z's and gland of mole, which are open in the hair follicles. Then what we will discuss, both meibomian glands and eyelashes differentiate during the second month of the gestation from a common unit. These eyelids and eyelashes. In eyelids, the eyelashes and the glands are originated, or the origin place or the situation place is the same, that is the common unit, that is in the gestation period. Okay. Now the first one is the congenital dystichiasis and the acquired dystichiasis. Dystichiasis means some eyelids which are folded inwards or the outwards is known as the dystichiasis. So it may be in the old age also and in the congenital also. And one grey line is also present in our eye, in our eyelid, in which it represents the pre-tarsal orbicularis muscle on our eyelid. Okay. Eyelid margin. In our eyelid margin, this what you say is it is present in our margin, in our eyelid margin. That is, our grey line is present in our eyelid margins. That is represents the orbicularis muscles, and the incision posterior to the grey line along with the eyelid represents the posterior lamella of the eyelid. Now the palpebral fissure. What is palpebral fissure? Space between the upper and the lower lid margin is known as the palpebral fissure. That is, when we open our eye normally, so this to this distance, this one is known as the palpebral fissure. Okay, now in at birth this width is 2 mm width and 8 mm height, and in adult 30 mm width to 10 mm height. In 50% people, lateral canthi is about 2 mm higher than the medial. Greater than this one is somewhat higher than this medial canthi. Okay, this one is 2 mm higher than the medial canthi. Lateral canthi placed lower than the medial canthi. Okay. Now, what is the structure of this eyelid? First one is the skin. Skin of the eyelid is the thinnest skin of the body. Okay, and this laxity, decreases with the age. Laxity of the eyelid decreases with increasing age. This is the dermatotrichiasis. Okay. Then here the subcutaneous tissues are also present, and the connective tissues are also present, and which is not having any of the fat. Okay, distended by the edema and blood. Striated muscles. What are striated muscles? Striated muscles are the orbicularis oculi, main protector of eyelids, innervated by cranial seventh nerve, and is divided into three parts: pretarsal, preseptal, and the orbital. Three parts. This muscle is divided into three parts: pretarsal, preseptal, and orbital. Then what is the pretarsal part? What is the pretarsal part? The tarsal plate which is present in our eye, before that, with the starting of that tarsal plate is known as the pretarsal part. Superficial origin, MCT, deep origin, post lachrymal crust, deep head views near common canaliculi. What is the canaliculi? In our eye there are two canaliculi. In each eye there are two canaliculi. First one is upper one and another one is lower one. And it is attached by the canthal tendon. Here laterally it is attached by the canthal tendon, and the resulting lateral pole creates a negative pressure in the lachrymal sac and draws the tears from the canaliculi into the sac, or into the lachrymal sac, you can say, into the lacrimal lake, you can say. Okay. Then preseptal part arises from MCT medially and forms lateral palpebral draping laterally. Orbital portion arises from MCT, frontal bone, maxillary bone. Fibers form a ellipse and insert below origin. Near eyelid margin, fibers of pretarsal part is the muscle of pars ciliaris, which is present in the ciliary muscles, creates the grey line, play a role in mammalian glands discharge, blinking, and in the position of eyelashes. In this there is a great role of the muscle that is known as the pars ciliaris. Then we will study about the LPS. What is LPS? LPS is originated in the apex of the orbit from sphenoid bone and courses forwarded as muscular portion for around 40 mm, then descends vertically and fans out as embryonosis around 15 mm long. Now, what is the Vitna ligament? It is located in the transition zone, which is used for the Lockwood ligament. Okay. Now, what is the submuscular connective tissue? Nerves and vessels of the lid lie in this layer, so to anesthetize the lid, injection is made in this plane. It means the submuscular connective tissues are placed in the nerves and the vessels of the lid lie in this layer, so that if we want to anesthetize the lid, then we can inject the anesthetic in this layer and the whole eyelid will be anesthetized. Splits the lid. Upper lid communicates with the suboperineal stratum and scalp, dangerous area of the scalp. Fibrous layer. What is a fibrous layer? Lens fibrous tissue that forms the skeleton of eyelids, give them shape and firmness. 30 mm long, 1 mm thick, upper tarsus 70 mm in height, lower tarsus is the 5 mm in height, and the tarsal plate have rigid attachments to the cranial. The upper tarsus contains the approximately 30 mammalian gland, and the lower is approximately the 20 mammalian glands. These glands are the oil secreting glands, which are also present in our face and our body. And now we will study about the orbital fat. What is the orbital fat? In our eye, the fat is also present in our eye. What is the function of that fat? That provides the cushioning effect to our eye. Cushion means soft effect to our eye. Hair all over the fat is present in our eye. This one. Okay. Now the medial canthus tendon. What is medial medial canthal tendon? Splits into upper and lower bands at medial canthal. These contain lachrymal caniculi, enclose the caruncle, and gives the shape to the medial canthi. Okay, medial canthal tendon. What is that? Is that about the same position as the form plate in any operation involving the removing and reposition of bone superior to MCT, there is risk of advancement of the CSF leak. Okay. Now, what are the fractures at the median? If the fracture can be done at the medial canthus, cause the medial canthus to be displayed laterally, that is the talicanthus. Then the lateral canthus tendon laterally attached to vitrinals and medially to end of upper and lower tarsal plane. Laxity of the lower eyelid is a major cause of the atrophy. Occurs due to lengthening of the lengthening of the lateral canthus with age. Lateral canthalotomy is a site-saving procedures to relieve the orbital pressure due to retrobulbar hemorrhages. Non-striated muscles, Muller's muscles. Muller muscles originates on undersurface of the insert along upper eyelid superior tarsal margin, and the peripheral arterial arcade is found between the laps. Surgical landmark to identify the Muller's muscle. Muller muscle. Now, what is the this one? What is the how we can rule out the fracture. Fractures can be ruled out by the MRI or by the X-ray of the eye. Splits into upper and lower bands at medial canthi. These contain lachrymal caniculae and enclose caruncle, delimit and give shape to medial canthus. By reading this topic, you will be able to know about the anatomy, development and embryology of the eyelid. That is important for your this semester exam, and its anatomy is important for your further studies. If anybody wants to do the clinical job, then for clinical job also it's important to know about the anatomy of eye. That's all for today's topic, and thank you everybody. Namaste beta. And if anybody is having any query, then comment in comments.